Cardiac care has all evolved over the last, say, 40 years to take care of the emergency situation. That's now changing to the idea that we can maybe recognize this disease, which has been long in coming, a lot earlier, and prevent that acute emergency. That's the new thing.
South Carolina Heart Center got involved with and just decided to deploy cardiovascular CT because we identified that there were many situations where our current imaging technology was not meeting the need. South Carolina Heart Center is a large cardiology practice consisting of 28 cardiologists. We are committed to deploying imaging technology to the fullest level in order to meet the needs of our patients and meet the needs of our enterprise.
It's an opportunity we didn't have before. We always had to look for markers of the disease and so on, but now we can actually go in and find not the characteristics of the disease, but we can see the disease and where it's located.
I've been an invasive and interventional cardiologist for 20 years now, and I'm out there every day in the real world in a state with one of the highest event rates of coronary artery disease in the country. One of the things that excites me about CT angiography is we now have a technique that can combine information about the lumen of the vessel, percent stenosis and the like of that, with a bigger appreciation of what's going on in the wall of the vessel. We can see the plaque.
Cardiovascular CT has a potentially tremendous impact on the efficiency of the cardiology enterprise. Patients who receive a CT or cardiovascular CT procedure consume very little physician time, but yet the cardiovascular CT imaging procedure yields a great deal of information that the cardiologist and/or the primary care physician can use in determining the best treatment plan for a patient.
There's lots of patients we've sweated over for 30 minutes, an hour, in some cases, difficult cases, hours in the cath lab, trying to acquire images that can be made within minutes under a CT scanner.
I think people are going to need to learn this because it does address very discrete clinical questions very quickly, very safely, and best of all, non-invasive.
Is it going to replace the need for cardiac catheterization? Is it going to make me obsolete in the cath lab? I think clearly, no. I think it's a procedure that will help us ultimately in the cath lab. And I think what people will find is once they start viewing these images is they can relate this anatomy very quickly to the types of imaging techniques we're already very familiar with in cardiology.
Cardiovascular CT makes financial and strategic sense. Financial sense in that it's an imaging modality that, like echo and nuclear, that does not require a cardiologist to be in the CT lab during the imaging procedure. There is a specific CPT code for all CT angiography applications, and that CPT code reimbursement is adequate to make the cardiovascular CT profitable with regard to CT angiography. The cardiovascular enterprise is connecting to that patient at an earlier age and stage of the disease, thus treating that patient for a longer period of time.
We now have access to information we didn't have, and we have the realization that that information is extremely valuable because we can prevent the #1 killer in this country by dealing with it early.
One of the positive aspects of cardiovascular CT is that it allows the cardiology group, the cardiology enterprise, to provide a new service to primary care physicians as they try to treat their patients with cardiovascular disease.
We're really looking at the tip of the iceberg. I think what CT angiography has the potential to do for us is look inside and see what's under that iceberg.
So I think right now, people that are coming on board, investing in this technology, offering it to their patients, are really part of a vanguard movement that's going to bring the pressure to focus the fact that this is valuable enough to pay for and reliable enough to depend upon for your medical care.